I think depression and anxiety, they take a turn in a direction of like maybe looking at a more intensive program like IOP or PHP when there's thoughts of suicide or thoughts of even not necessarily like they have a plan or want to do something, but it's something that's just constant in their mind that things are just too hard. Like, I can't do this anymore. It's hard for me to go to bed anymore. They're not going to school or they're not going to work. Not interested in things they used to be interested in, to a point where it's very noticeable, and they're failing classes, and they were, let's say your kid was into soccer and into sports, and then all of a sudden doesn't want to go anymore. Some really significant shifts in like who they are and what has brought them joy in the past no longer brings them joy, and you're concerned about their safety. At that point, I think IOP and PHP could be a really good option. So when you're looking at levels of care for behavioral health, I mean, there's a spectrum, right? So you're looking at outpatient therapy, which is individual, weekly, every other week, which is kind of your typical what we are most familiar with. And then I think it goes to the other extreme. The most familiar is inpatient psychiatric hospitalization, which that is where someone is at danger to themselves or someone else, and they need immediate stabilization and or medication stabilization. So then at that point, that's when you would go to a local ER, call your local crisis counselor or crisis agency and get help, and they can get you help from there. When you're looking at that in-between place of IOP versus PHP, intensive outpatient and partial hospitalization, I think partial hospitalization can be a scary word sometimes. And so to understand it better, it's an outpatient program that's extremely intensive. So it's typically 5 days a week, anywhere from 4 to 8 hours a day, depending on the program. Some of those programs will offer education options. All programs will offer a possibility to include your education, whether you're doing online school or working with your public district to get work if your loved one is not in school. We do offer that education component for a short part of the day, and some programs offer it for a longer part of the day. It's a lot of supervision, so they're here all day for many hours, and so we get a really good look at different things, behaviors, dynamics in the family. A lot of times they need supervision for stability because there's safety concerns with being danger to self or someone else, and so we're here to help support that. We're also here to support them in real time, because I think with outpatient therapy, therapists will give you the skills and then you go home and you work on those skills. And when you're in a program all day long, we're going to see a lot of those behaviors here, and we're going to be able to help support and process through skill building in real time, which I think is really unique and important when we've got a really high acute loved one who needs some additional support. We offer both programs because sometimes we get clients who are step downs from inpatient hospitalization, where they are stepping down from a hospital and do need a higher level of stabilization, which would be like your partial hospitalization. And so once they come to our program for, let's say, 6 to 8 to 10 weeks, they might have to go back to school after that. And so we want to see how they transition. So a step down to IOP to give them less time in the clinic, more time in the real world, but we're here still a very strong support for them and able to help stabilize in real time. I think it's a really important process to keep them connected because, for example, if, the kid's not in school and they're attending the PHP program, and then we graduate them and they leave and they go to school, and they'll get all these new transitions, new anxieties, some triggers that are coming up. We're able to help support that if they're in an IOP program, because then they'll come after school and we'll be able to help support through that transition. So I think it's truly just helping them transition to a lower level of care, so that the ultimate goal is to get them to outpatient so they can really continue that healing journey. I think risk levels with suicidality can be very scary. And I think, people talk a lot about passive suicidal thoughts. And what that means is sometimes I think about it, or sometimes I think I would be better off, but I would never do anything, or I don't have a plan. I just sometimes feel like it's not worth it anymore. That would be a time that IOP or PHP could be really beneficial, because I think we could really support kind of where that's coming from, how to stabilize you and give you some skills to get you to feel more supported, more stable. When you're having thoughts of actually following through with this plan or feeling like there's really no way out, that's the time that you should go to the hospital, call your local crisis line. We're happy to support once you're stabilized, but when that would be an active danger. And I think I've seen, at least in this role that I'm at Embark, sometimes we get clients who come in for an intake who are actively in danger. And so we will send them to the hospital to get stabilized before they come here. And so I think that's one thing I would let even just outpatient therapists know who maybe don't work with as much high acuity, is that there's a difference between passive thoughts, which would be appropriate for us, or maybe passive thoughts that aren't getting better or they're increasing, versus someone who's actively making a plan. That's the time to get them in a hospital immediately. And so I think that's one of the things that I've noticed here is just the education around risk. I think one of the other unique things about our Scottsdale IOP and PHP that makes us different from others, specifically the young adult program, is that a lot of IOP programs for young adult are co-occurring, so primary substance abuse or mental health. We are primary mental health, so substance abuse is not something that we treat as a primary diagnosis. There are some wonderful programs in the area that we refer to, but I think it's important that we remain mental health, because I think there are a few programs in the Valley that provide support for just mental health. A lot of them are co-occurring, and I think we can really hone in on some of those mental health issues. And then there's some wonderful programs that we can refer to that are substance abuse. I think one of the other unique pieces of our space, because we have a larger space than other IOP programs, that there are times that we can even offer space for parents to work remotely if their child is in PHP and they're here all day. Sometimes we have space available for them to do their work, and it's a private space where they're away from the clients, but they're also able to live their life, because I know this is a huge commitment for families, and we do understand and really try to accommodate their needs, because at the end of the day, like, they still have to work and they still have to live their life. There's usually other siblings, and we want to support in any way we can. One of the populations that we've noticed that could utilize more support or could benefit from our program are college students. I think really high-performing college students who put a lot of pressure on themselves, a lot of perfectionists who put a lot of pressure on themselves to get good grades, to do all the things, and they start to get really derailed, or they start to dysregulate, they start to get paralyzed with anxiety, they stop doing their assignments, and then they start to kind of shame spiral a little bit. We've actually found a lot of success in our IOP program for young adults in regards to we've had a few students that they've actually taken a break and taken a semester off, which we can actually support with the school and do some documentation to ensure that they don't lose scholarships, that they can continue on with their program, so that they can stop, just take a minute and really focus on themselves to get some skills to better manage and how to regulate just the stressors of being an adult. I think transitioning from 18 to, your home to real life, and then everything's on your shoulders and you're still very young and your brain's not fully developed, it can be really overwhelming. And so I think this program could really benefit those students to just take a few months and just work with us, get the skills, and dive into kind of what's driving that, because a lot of times there's a lot of deeper issues that are driving that high performance, the pressure, the shame spirals, and we can help support that piece. I think one of the things that we've incorporated here at Embark Scottsdale are trial days. So often, IOP is a big commitment for anybody, and so it can feel scary and anxiety producing to know that you're going to be attending a group with people you don't know for a long period of time. And so making that jump can be really scary. So we've offered trial days to clients where they can come spend a day in the program and do a day just as any other IOP would. And they're able to experience it without the commitment part. And we've found very high success in people coming back, just knowing that this is something that would work for them, and that kind of anxiety attached to the commitment is reduced, and they're able to really just kind of see what we're about, meet the team. We have a great team at Scottsdale who are here to support, and really individualized care. And I think people see that when they're able to try it out.